Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have incretin mimetics. Okay, incretin mimetics. What is an incretin? Incretin is a glucagon-like peptide. One incretins include glucagon-like peptide one. So in the incretins, this will include glucagon like peptide 1. It will also include glucose dependent insulinotropic polypeptide. It also includes glucose dependent insulinotropic polypeptide. What are these? Both of these are released at the time of the meals, or they are released after meals, mainly from the upper and lower bowel. They are released at the time of meals or after meals from the upper and lower bowel. And what does they do? They will increase the glucose dependent insulin action. What does that mean? They will do the following things. These will increase the insulin release. So these incretins will cause the insulin release. They will decrease the opposite of insulin is glucagon. So they will decrease the glucagon release. Okay. They will decrease the appetite of the patient. Okay. They will decrease the gastric emptying. And they will also increase the beta cell mass of pancreas. Okay, so these are the main actions of incretin mimetics.
thank you and thank you for watching.